Good afternoon. Thank you for joining us today. I am Andrew Doe, Vice Chairman of the Orange County Board of Supervisors. First, a reminder to everyone. Please stay home as much as possible. Wash your hands regularly. And while face coverings are not a substitute for physical distancing or frequent hand washing, wearing some kind of face covering could provide additional benefit when you absolutely must leave home for essential activities. Please know that your county government is working hard to assist you during this difficult time in the days and weeks ahead. We understand that many of you in the community, our neighbors, are in need of help during this difficult time. And many of you are looking for resources to help you maneuver through the challenges of this shutdown, whether as an employer, an employee, or a business owner. In response to this, Chairwoman Michelle Steele and I announced the launch of COVID-19 info.ocgov.com last week. This website offers a wealth of resources and valuable information for everyone, from businesses to individuals. It will be updated regularly to better assist our county residents. The county has also extended our service hours for services in many of our departments. But we know that this crisis has placed a tremendous burden on all of us. Maintaining mental well-being is vital to us and to our family at this time. Last Tuesday, the Board of Supervisors voted to support my proposal to create new mental health, physical health, and substance use programs to address the stress, anxiety, fear, and mental health challenges resulting from COVID-19. As you may recall, in 2019, Orange County entered into a public-private partnership called Be Well OC to create a simple central hub of resource to access support services and mental health education in the county. I thank Be Well OC and all of its participants for answering this call to action. Now, we need to allocate resources so that Be Well OC can deliver the much needed services as we had envisioned that it would be for the County of Orange. Yesterday, I sent a letter to Governor Newsom urging him to institute the recommendations made by the Steinberg Institute that would temporarily allow counties the flexibility in the use of its funds under the Mental Health Services Act, also known as MHSA. With this flexibility, Orange County can increase our capacity to provide much needed mental health services and use our MHSA funds wherever the need is the greatest. In addition, I requested that the governor allowed MHSA funds to be temporarily permitted to cover substance use disorder programs. Allowing MHSA to cover both mental health and substance use disorder enables Orange County to create a holistic mental health system that is so vitally needed at this time. An issue that we will also cover in today's press conference is the county's response to homelessness during the COVID-19 epidemic. Last week, Governor Newsom launched Project Room Key, which aims to provide financial support for counties for hotel and motel rooms to protect our unhoused population. But even prior to the governor's directive, Orange County has been working to find hotel and motel partners to temporarily house homeless individuals throughout our county. The Orange County Board of Supervisors has been working proactively from the first day of this pandemic to ensure the safety and security of all of Orange County's residents, including those who currently do not have a home. In the updates today, you will hear from Jason Austin, our new Director of Care Coordination, who will provide an update on all county actions related to Project Room Key. You will also hear from my colleague, Supervisor Lisa Bartlett, as it relates to Project Room Key and the response from her district. And lastly, we will also provide you with the latest updates from the healthcare agency, David Solelis, as well as an update on jails and court operations from our sheriff, Don Barnes. Again, I appreciate all of you joining us today. And with that, I would like to turn the podium over to Jason Austin.
Good afternoon. I'm Jason Austin, the Director of Care Coordination with the Orange County Healthcare Agency. As the Governor has said, significant emergency protective measures are necessary to mitigate the spread of COVID-19 among our homeless population. Individuals experiencing homelessness are especially vulnerable. Many have no option to self-quarantine or isolate. Unsheltered lack consistent access to showers, restrooms, hand washing, and sanitation supplies. Because many people who are homeless are older adults or have underlying medical issues, they may also be at higher risk for severe disease than the general population. I'm here to talk about how the county is helping these residents, and which is absolutely critical to protect public health, flatten the curve, and slow the spread of COVID-19. The following areas of focus have been identified to respond and protect the most vulnerable populations. Strengthen current shelter practices and provide guidance on mitigation strategies to prevent transmission. Identify locations to isolate medically stable, symptomatic COVID-19 positive individuals. Protect those experiencing homelessness with underlying medical conditions or those over the age of 65. And encourage those who are asymptomatic and experiencing unsheltered homelessness to access shelter and services. The identified temporary resources are the following: hotels and motels for those who are sick and symptomatic. Temporary isolation shelter, we have identified the first hotel with 127 rooms. This hotel is secured for a 3-month period and began receiving clients on April 3rd. We are working on securing a second lease, signing this week to add an additional 70 rooms. We are looking at a third site to add additional rooms as well within the next week. Illumination Foundation, a homeless service provider, will manage the hotel sites and provide medical oversight to the clients, along with medical staff, transportation, support services, on-site meals, 24/7 security, and coordination of discharge transitions. Clients will only be permitted to leave the premises via Illumination Foundation van, transport, and no visitors are allowed to ensure self-quarantine and isolation protocols. Walk-ups will be permitted to the locations, and referral partners are shelter providers, county outreach staff, hospitals, and law enforcement. We have also worked to secure, in the process of bringing online Joplin for vulnerable populations. The max capacity will be 100 individuals. The opening date is pending the resolution of water quality test results, but we are anticipating opening within the next 7 days. Illumination Foundation will provide medical staff, 24/7 security, case management, supportive services, and on-site meals. Referral partners will be shelters who identify appropriate clients with priority for those in large congregate settings or those who are unsheltered. We are also working to bring on sprung shelter locations. There will be 2 to 3 sites with a max capacity of 60 to 80 individuals each. The target opening date for the first sprung shelter will be in the first week of May. We'll be looking at the county as a whole and focused on regional park locations depending on the need throughout the shelter system. The Illumination Foundation will also manage these sites. They will provide medical staff, transportation, support services, and 24/7 security. The county will establish referral criteria and share it with providers as the opening date nears. We are actively engaged in discussions with other alternative sites like college dorms, and more to follow over the upcoming weeks. I am open for questions, and I would like to introduce Supervisor Bartlett.
Thank you, Jason. Good afternoon, everyone. Supervisor Lisa Bartlett, Supervisor for the 5th District. We're all working through some very challenging times right now. Everyone has to do their part. We are all in this together. The EOC, our Emergency Operations Center, under the Governor's Project Room Key, contracted with the Ayers Hotel in Laguna Woods as a temporary isolation location for South County homeless residents. The EOC, within their responsibility and authority, is there for a reason, to make the hard decisions quickly while taking those decisions out of the political process. That's the way decisions in an emergency should be done. The county always aims to work with our businesses and enter into endeavors to be a good partner, particularly during a crisis. As such, I would like to report the Laguna Woods property is no longer an option. I'm here to remind you, though, every county across the state is experiencing the same challenges that we are. As president of the California State Association of Counties, I have the unique opportunity to collaborate with all 58 counties across the state and protect the county's relationship with the governor's office. Project Room Key is a county-state partnership to provide housing and isolation for individuals experiencing homelessness at high risk of COVID-19, particularly the sick and medically vulnerable. The goal of this effort is to provide individual shelter options in hotels, motels, and trailers in order to protect human life and minimize strain on the healthcare system capacity. Without a hotel or motel to house and isolate this population, it exposes the entire community to an increased risk of contact and of fewer beds at our local hospitals. Even during ideal conditions, individuals lacking stable housing are more likely to use hospital emergency rooms. This is what we need in order to contain everything. This is how we do it. The governor has tasked all of us with a statewide goal of 15,000 hotel-motel rooms across the state. Hotels and motels across Orange County are working with us to fulfill the governor's directive, and they're doing so voluntarily. The Ayers Hotel was the only hotel to step up and do their part in all of South Orange County. The county simply cannot take a hotel. The property needs to be offered to us. I know this is difficult and challenging as a time for everyone, but this is a public health crisis, and we need to address it as a full public body and do it together. Every single location and every single locality within the county is being considered. The county cannot fight this virus alone. I know we are asking a lot of all of you to put your trust and security in the county's hands, but I guarantee you, right now, this is the only way to do it. This is not only the responsibility of our county and of our state. This is a responsibility for all of you to protect your neighbors, your family, and your friends. If everyone continues to do their part, continue to wash your hands, practice safe physical distancing, to stay at home, we will rid this virus from our communities together. And it's so important for everybody to play their part. At this time, I'd like to turn it over to our County Sheriff, Don Barnes.
Thank you, Don Barnes, Sheriff Coroner, Orange County. I want to brief the public and the media on a few of the things we have going on within the Sheriff's Department and law enforcement and public safety as a whole. First, it should be known that we still have brave men and women, not only the Sheriff's Department, but also of our municipal police departments and fire agencies who are still coming to work every day to address the issues that we face as a community. And I applaud those efforts of those groups, as well as our healthcare professionals, doctors, nurses, and others who still are going to work, facing the challenges that we have and preparing for things that might get much worse. We still have an expectation of the public to still abide by the law, and we still have law enforcement professionals that will respond to and address those issues as they do come up. It is good, though, that during this crisis, calls for service have declined, and certain crimes have also declined as a result. Property crimes, burglaries have decreased, traffic collisions have decreased, and happily, domestic violence and some disturbance calls have not seen a significant increase as more people are home. I do also want to thank the public in our efforts to serve you, and the way we changed the way we're doing that. All of our public counters have been closed for several weeks. We're delivering many of our services remotely or via the internet or via the phone, and that's important because we want to maintain social distancing as best we can while doing those things. Regarding the jail specifically, we have made some profound changes in our services and the delivery of those services within our jails. Most of our programs have been temporarily seized during this time. Despite our best efforts to get out ahead of this and operate in containment, we have had some exposures of COVID-19 within our jail population. To date, we have in medical isolation 18 inmates. 6 of those 18 inmates have tested positive for COVID-19. 9 of those 18 are pending test results, and we have 166 inmates quarantined. The quarantine is not those who are symptomatic. Those are individuals who we believe were exposed to individuals who were positive for COVID-19 and are being separated from the jail population and monitored. If any of those individuals do show symptomology, we will take them out and isolate them as per protocols by the healthcare agency and consistent with CDC guidelines. We also have released, as of March 28th, over the last 10 days, 327 sentenced inmates for low-level offenses, including in those 327 were 108 who were designated by the healthcare agency as medically at risk. Those at-risk populations are those 65 or older or have previous existing healthcare conditions. That release since about a month ago has decreased our jail population by almost a quarter. As of March 6th, our jail population was over 5,200, and as of this morning is under 4,000. I do want to stress, though, these individuals who we are releasing early are sentenced individuals who are scheduled to get out of jail anyway. Those have 30 days or less remaining on their sentences, and those who are medically at risk follow the same guidelines of those for low-level offenses and had up to 60 days remaining on their sentences. Sadly, we do have 2 deputies, both working in our correctional facilities, who have tested positive for COVID-19. Following the same guidelines, they are isolating themselves at home. I spoke to one of them recently. He's doing well and hopes to have a full recovery of both of them. I do want to just stress the importance of what we are experiencing in our jails. They only have to look as far to the east as the Riverside Sheriff's Department, who just recently lost 2 of their deputies who tested positive for COVID-19, Deputies Terrell Young and Deputy David Worksman. And my heart goes out to Sheriff Chad Bianco and the family of the Riverside Sheriff's Office and the community for their loss. Quickly to touch on what's transpiring in the courts, the Chief Justice about a month ago issued some guidelines that have come down on how to help the courts navigate through the coronavirus pandemic as it relates to court processes, hearings, trials, and also how to accommodate those within our jails. We have a working group that's led by several of the judges at Superior Court, as well as the public defender, the district attorney, and members of my staff, trying to work through some of the logistical challenges of getting these hearings done, including the implementation of several technology solutions that have mitigated the necessity to move inmates back and forth to court. That will still be our goal. My hope is that through that process, they will come up with other solutions that will help mitigate some of the low-level offenders who are pre-trial, awaiting trial in a way that would not create any public and our staff safe going forward. The one last thing I would like to ask and remind our viewers is first responders and medical health professionals are here to serve you. We have an obligation to go to work and make sure that those services are provided. Please help us by staying at home whenever possible. Only leave when it's absolutely necessary for essential services, and do so safely by washing your hands, practicing social distances, and making sure that you keep your family safe. With that, I'll turn it over to Frank Kim.
Thank you, Sheriff. So I know that we have questions from the media that are queuing on our conference call line. So moderator, do we have our first question?
Yes, thank you. Ladies and gentlemen, once again, to ask a question, please press 1, then 0 at this time. Once again, it is 1 and then 0. And we do now have several lines queuing up. It should be just a moment here for the first question. And once again, it is 1 and then 0 to queue up. With our first line, we will be going to Teresa Walker at the Orange County Register. Please go ahead.
Hi, I have had questions both for Jason and for Supervisor Bartlett, but maybe you guys can answer them, I don't know. Did we hear you correctly in saying that the Ayers Hotel in the Little Woods is not going to be used as a site now?
Hi, Teresa. Supervisor Bartlett here. Yes, that is correct. The Ayers Hotel had contacted us over the weekend and asked to be released from their contract, so that is correct.
Did they say why?
You know, I'm going to call up our CEO. I was not in the office over the weekend, and so I'm going to turn that over to CEO Frank Kim to answer.
So on Sunday, we were contacted by the Ayers Hotel, and they respectfully asked to be released. We are in contract with that entity for other hotels in the county. So they specifically asked to be released from the Ayers Hotel contract. They didn't indicate in their communication why, but I assume it's related to the community concerns that were expressed directly to the ownership and management of that particular hotel. I think you can ask a follow-up question.
Okay. So there are now 2 other hotels that have been secured. Can you tell us what those locations are?
Sure. Maybe I'll bring Jason Austin from our care coordination office. I know that we're working on multiple hotel sites throughout the county, including alternates within the southern part of the county. As you know, Teresa, our goal always has been to provide regional services and a shared burden across the entire county. So we are looking at tent facilities within our regional park structures, as well as hotel sites. I know they've been mentioned before. We're looking at the city of Orange. There is a site there. we recently signed an agreement with a hotel within the city of Stanton, and we're looking at other locations as well. So I think I answered that.
And you said the first site, which I'm assuming is the heirs in Orange, began receiving people on Friday, is that correct?
I'll ask Jason to respond to that.
Yes, the first site in Orange did receive their first referral in on Saturday, and they are processing several new referrals today and expect to have more individuals intaked into the program in the next few hours.
Can you tell us from what shelters they were moved from?
No, we're not going to release that level of data, but we can say that we are focused on a regional approach. And so if somebody is calling in from a certain part of the county, we are striving to open motel and hotel sites to respond to those requests in the same spa areas.
And can you tell us why you're not going to release that level of data?
At this point, we're trying to get these motels off the ground and launched. And I think we are very concerned about letting the providers get to their work and ramp up the motel sites.
Okay.
Thank you. Next we will go to Tony Cabrera at ABC7. Please go ahead.
Yeah, I don't know who can answer this, but like at what point can we say that we have flattened the curve? What number do we need to see? How many days in a row? I think a lot of people would like to know at what point will their efforts of physical social distancing are paying off. I know last week and the week before we weren't really, it was too soon to tell, but when will that be able to be assessed?
Thank you for that question. I'll ask our Public Health Director, David Salelis, to come up.
So our concern, as it has always been, is in flattening the curve, is in slowing down the spread of infection throughout Orange County. If you take a look at the trend graph that's posted on the ochealthinfo.com/novel coronavirus website, you'll see that our trend is still moving upwards. You'll notice that we've had some high days, some low days, but overall the trend has been still moving in an upward trajectory. What we are watching for is for that to flatten out, to have days where it doesn't increase and multiple days in a row really where it begins to decrease. Once we see that, we will begin to have pretty good confidence that we are moving in a downward trajectory, in a downward direction and flattening the curve, as you said. So our message to Orange County is to continue the good work that you've been doing in staying at home, only going out for essential services or essential business. Doing so will help to flatten that curve ongoing. It will also to protect those most vulnerable in our communities, those 65 and older, and those with underlying health conditions. So we are going to be in this for a while, and an end date is not something that any of us can put a measure on at any level of government in the country right now. We really have to watch the data and watch how the virus moves through our communities and keep up the good work of staying at home.
So there has been a good response as far as the number. Are you saying like it might have been worse if we weren't staying home?
So the goal of stay-at-home orders is to create the social distancing, is to reduce the opportunities for the infection to spread from person to person. At all levels of government throughout the country, we are monitoring daily our case counts and monitoring those trends and those curves. And our hope is that in doing the good work of social distancing, of staying home, that will begin to bend that curve downward. I think folks in the United States are hopeful that the work that we're putting in now will do that. I know in California we were early days in COVID time. March 19th, I believe, is when the governor issued his initial statewide stay-at-home order. So we're hopeful that that over time that will make the difference. Remember, we're only a little over 2 weeks in to the stay-at-home. So I know people in our community may be getting a little bit of cabin fever, maybe feeling like they're cramped in, and when is when is this going to change and when is it going to let up? And this is really the time for us to redouble our efforts and recommit to staying at home, to protecting those in our community who are most vulnerable, so that we can begin to see the flattening of the curve that we want to see and move into the next phases of our response to this disease.
Thank you. Next, we'll go to Erica Ritchie at the Orange County Register. Please go ahead.
Yes, hello. So my question is specific to Mission Hospital data. And I was wondering if there's any information that you can provide regarding how many patients have died at the hospital, how many are in their ICU, and the volume of patients that have gone to the ER that have exhibited severe symptoms.
Thank you for that question. I'll ask David Solalis, our Public Health Director, to respond.
In terms of cases and hospitalizations, what I can tell you is that we are reporting today 842 cumulative cases in Orange County, with 14 deaths that have occurred cumulatively. Today we added 51 reported cases and thankfully no additional deaths today. Our hospitalization data we look at an aggregate level across all of our hospitals, so we're monitoring all hospitals in Orange County. And today we reported out 130 individuals hospitalized. Of those, 72 are in the intensive care unit. One word that I will caution on hospitalization data that's posted on our website: it is very much a point-in-time number, so that we all know that somebody who is hospitalized can move from ICU back to general bed, can be discharged. So those numbers are really point in time. We have strived to include on our website and have included on our website a daily chart that will show you hospitalizations over time. What we are seeing overall is an upward trend in hospitalizations, though because of the good work our hospitals have done to reduce elective procedures, to put in visitation restrictions, and all of the work they're doing to surge to meet the moment, we are seeing that our hospitals are only at about 50% of their capacity. In other words, the beds are only about 50% filled in terms of the beds that are available.
Okay, thank you.
Thank you. Next, we'll go to Nick Garda with Voice of OC. Please go ahead.
Hi, thank you guys for answering the questions here. I had a question on homelessness and the homeless shelters. Obviously, those are seen as very essential to preventing the spread of COVID-19 in Orange County. We understand the governor's office has been reaching out to the county, perhaps not happy with the pace of motel beds coming online. At the same time, obviously, there's some challenges in getting those secured. Wanted to ask, what is the message the county is hearing from the governor's office, and what do you feel is necessary to be done to reach the state and the county's goals in getting those beds online at the pace that you feel is necessary?
Sure. Thank you for that question. Before I turn it over to Jason, what I'd like to say is that I'm incredibly proud of our community and the county effort over the last several years on homelessness. Just this past week, the Placentia shelter opened with 80 additional beds. That is partially funded from the County of Orange, as is the Buena Park shelter that is under construction. We were also able to transition 2 of our Army programs into a 24/7 program with support from the city of Fullerton and also in Santa Ana. So I think over the last several years, and as you know, Nick, we also are in the midst of construction on our Yale Street facility. And when you look at programs like Yale and you look at Bridges in Anaheim, those are programs that have an FQHC on site, co-located. So I see the county's efforts over the last several years as being incredibly consistent and impactful, and exactly what the governor has asked for. So in this immediate response to a crisis, we can certainly talk about our efforts on moteling and other sites, but over the last several years, I don't know that there are too many counties that have done as much as Orange County has under the leadership of the board. So I'm very proud of them and our team, and I'll ask Jason to add additional comments. Thank you.
So Nick, what I would add is that CDSS, the state, HUD, are all offering as much support as possible. We've had several calls We've had discussions about what they can bring to the table, how we can all work together. But the process here in Orange County in negotiating motel leases is complicated and it takes time. And I think we have moved at a strong pace to bring up the first few motel sites. And we will continue to add on parts of our new continuum of services over the next upcoming weeks.
Thank you. And next
Thank
we
you.
will go to Terry Sforza at Orange County Register. Please go ahead.
Hi, guys. I think that this is for the healthcare agency and David. We're hearing about some more, organizations that are offering both the PCR testing and the antibody testing in North County, and there's a group in South County that's also offering certificates that, say if you come back negative, you're cleared to reopen your business and go back to work. I'm trying to see if you guys have heard about this, what you think about that, and what any certificate like that hold any water, I guess.
Thank you. So on the topic of testing, this has been, I will say, a challenge for California overall, so much so that Governor Newsom on Saturday redoubled the state's efforts on testing, acknowledging that the state has not stepped up in the way that he would have hoped in terms of our ability to bring testing online and widely available to the people of California, including people here in Orange County. Specific to your question about serology tests, so serology tests or blood tests are antibody tests. They check for the presence of an immune response to COVID-19. They don't detect whether or not the virus is necessarily in your system in the moment or not, but whether or not you've had an immune response. Serology tests have an important role to play in surveillance, and they may have a role to play in helping us understand what percentage of our community is immune. We are hopeful that through guidance from the Food and Drug Administration and from the California Department of Public Health and others, that we will get a system in place that can use those serology tests to their best potential. The governor announced on Saturday a development of a serology test at Stanford that is undergoing FDA approval. There are numerous, I think, talks going on at state and local health departments about how best to employ those. I think it's a little early to talk about a certificate that somebody could give you to say you are clear and free to go back to work. Right now, when we are looking at reporting of cases and diagnosing cases, the PCR test or the PCR test that we're currently running is really the test that we use to make a diagnosis of somebody. And I guess I should add, let me add as well. We are, in terms of clearing individuals to go to work and assuming that folks who are involved in essential work and essential activities, we are messaging to everybody in Orange County, if you are ill, stay home. And if you have symptoms, stay home. Most people who experience COVID-19 will have mild to moderate illness, can be managed at home, and won't even need to necessarily see the doctor or be tested. The way that we can determine if somebody is okay to go back to work under CDC guidance at this point in time, whether they've been ill and tested or whether they've been ill and not tested, is that they wait for at least 7 days since their symptoms began, and then at least 3 days from symptom resolution. So when the fever gone away, when the shortness of breath and cough have gone away, people are deemed to be cleared to be able to go back to work, to be able to go out into the community for essential work and essential services. But remember, overlaying all of that is the stay-at-home order for all of us in Orange County to stay at home unless we absolutely need to be out for essential work or for essential services.
But I mean, so far as private entities offering these tests, I mean, does the healthcare agency, is that okay? I mean, are PCR tests available? I mean, out from your neighborhood doctor? I mean, I thought that they were in terrifically short supply.
So testing is increasingly becoming available. Serology tests are increasingly becoming available. their use and their ability for diagnostic purposes is really not there yet. So that is the challenge, is figuring out the appropriate use of these tests. And I would encourage anybody who has concerns about somebody offering testing that may not be appropriate or valid to check with the DA office's website and to register a complaint. I know they're aggressively following up on any complaints that come in about testing that may be done in a way that is not appropriate or consistent with federal and state regulations.
Okay, but just to be clear then, so if somebody's offering me a certificate saying, you know, Terry, you don't have any antibodies and the PCR test says you're fine, you can go back to work, that is not worth anything, that piece of paper?
I would not put stock in a piece of paper coming from anybody at this point in time other than a confirmed laboratory report of a PCR test that determines whether you are infected with COVID-19 virus or not. Again, I think there is a significant role that serology tests will be able to play in responding to our understanding of community levels of transmission in this country. I think we need a little bit more time and a little bit more guidance from federal and state officials about the best way to use those tests and about the best way to interpret the information that they'll be able to provide us.
At this point, the PCR tests that are, I guess, counted are administered by the county or in conjunction with the county? I mean, is there a private doctor who can offer these PCR tests and, I mean, they're looked upon as with the same value as the county's test?
The only test that's valuable to us in terms of determining whether or not somebody is infected with COVID-19 today is the PCR test. So we are not using serology tests as a means to diagnose somebody or to add them to the case count here in Orange County or anywhere in the state of California or the country at this time.
But if my doctor, who's a private doctor, is offering me a PCR test, that would still be, I guess, valid in the eyes of the healthcare agency?
So Terry, I think we've covered that question. So if we can move to the next question, please.
Thank you. Next, we will go to Margaret Carrero at KNX. Please go ahead.
Yes, I know there's a lot of talk about, you know, people staying at home, social distancing. There were reports of hundreds of people out at Huntington Beach's Dog Beach on Saturday. Why are there beaches still open? Is there anything that the county can do to maybe press the city to close the beaches down completely in order to ensure that that social distancing continues? And also, another question for Supervisor Andrew Doe about his plan to propose a new policy at tomorrow's board meeting with regard to essential workers wearing face coverings.
So let me first answer the question on our parks, and then I'll turn it over to Vice Chairman Doe. So I was out this weekend while I was running some essential errands, and I did pass by some of our county parks, particularly those along the beaches. And what I can share with you is that what I witnessed was a fairly light number of individuals that were utilizing the beaches, and they were all, at least in my observations, observing social distancing. What I think the county has desired to do, and I think that we've been very consistent about this, is to maintain those parks and beach assets as opportunities for individuals that can utilize those assets in a safe manner. And so long as that's the case, that was a desire that we've had. Now, obviously, there are times, throughout the day that I'm hearing reports that the crowds are growing. And I almost every Monday, I sit down with my park staff and we have an evaluation and a discussion, as we do with cities. So what's unique about Orange County is within our coastline, we have state beaches, city beaches, and county beaches. So we are trying to balance that so that there is a consistency to how all of those facilities operate. So I think what you'll see from us is that continued dialogue with our partners in cities and the state. And what I hope is for us to be able to maintain that asset available, but we are watching it very, very closely. If it becomes a problem, I'm certain that my staff and I will not hesitate to take further enforcement actions as appropriate. So with that, I'll turn it over to Vice Chairman Doe.
Thank you, Frank. As we prepare to settle in for an extended period of time when we will have to follow this protocol of social distancing and exercising personal sanitary practices. We also have to look ahead that eventually people will have to get food. People will continue to have to avail themselves of services. Then the question then comes to the critical essential services where people need food, they need medicine, they have to get gas. At the touch points where the public can transmit the virus, what can we do to minimize that risk? And that's when I refer to the California Department of Public Health face covering guidance. And I look to other counties, and I think the practice of requiring facial covering and as well as possibly gloves for all individuals who handle food, who serve the public, whether it's in a grocery store or in a restaurant, in a drugstore. I think those measures are necessary and would be consistent with our guidance to the public to minimize the touch points where we can exacerbate the issue of community transmission, which we believe is the main mode of transmission now for the COVID-19 virus.
Okay, thank you.
And next we'll go to Paul Anderson with City News Service. Please go ahead.
It's okay, all my questions were answered.
Then moving on, we will go to Spencer Custodial at Voice of OC. Please go ahead.
Hi, this question is for the supervisors. Just wondering if the supervisors of the board are planning on any kind of like an eviction moratorium similar to how Anaheim or Garden Grove has done it. I know the governor has passed one of his executive orders an eviction enforcement ban, but it also brings up questions that renters may face their landlords in court and can kind of add fees on the back end that way. Is the county looking at anything like that, for renters? And then also what would that do for mortgage payers? And the second question I had is, with the April 10th property tax deadline coming up, is there any kind of like delays and penalties or fees for people who may not be able to pay property tax by April 10th? And then on a quick side note to that, is there any information out there like how many mortgage accounts pay their, or how many mortgage holders pay their property taxes throughout the year through like an escrow account? And I'll just leave it at that for right now. Thank you.
Before I call up one of the supervisors to respond to your question, I can address the question related to property taxes. I don't speak for our treasurer. She is a countywide elected official, so she'll make her own statements. But in my discussions with her, she did indicate that following discussions with her peers, and also there was guidance that was released by the California State Association of Counties this weekend, indicating that significant impact, financial impact related to this COVID crisis would be used as one of the accepted criteria in terms of determining a waiver of interest and penalties, and that authority does rest with the local treasurer. With that, I'll invite Vice Chairman Doe.
On the issue of eviction moratorium, the governor has taken act, and his executive order is the law of the land at this point. And without trying to run the risk, or rather to avoid running the risk of conflicting laws, we would defer to state action on this matter. I also would like to add to what the CEO said about property tax. The law has provided the discretion within the treasurer tax collector to exercise discretion to find good cause. And with the latest action, again, by the governor, encouraging counties to exercise such discretion, it does provide the county more flexibility in the way that we apply the discretion for good cause. And I believe that the treasurer will exercise good cause and take into account the gravity of the pandemic that we are facing in judging the individual cases that are asking for a waiver of penalty and interest. Thank you.
Are there any additional questions?
A follow-up from Teresa Walker at Orange County Register. Please go ahead.
Hi, I just had a couple more questions for Jason regarding the hotel side. Can you tell us what hotel in Stanton has signed a contract?
We are still working on the lease. I would prefer not to release the name today, but once we have everything locked up over the next several days, I'm sure we'd be happy to send that name out.
Okay, and then, so my next question, I'm guessing you won't be able to answer it, because can you tell us what are the terms of these two contracts with both the ALO and the hotel that's coming on board in terms of what the county will be paying these hotel owners for the rooms, what the time frame is, and what will Illumination Foundation be paid for its services?
So as far as the time frame, I can say that we are doing a 3-month lease for the motels that we are moving forward with. As far as the amounts per motel, it really does depend specifically on the size of the motel and other factors, and I actually honestly don't have the amount here with me. The Illumination Foundation contract, at that point, honestly, we are doing a 3-month contract with IF to provide overall management of 8 sites, and so that includes 4 motels, 3 sprung structures, and Joplin. And so for the 3-month period, we have negotiated a $16 million contract that includes 24/7 coverage of all the sites, including nurse and site supervision, as well as security.
And can we get copies of these leases?
The leases themselves, I'm sure we can work something out with that. As I said, we only have one fully executed lease at this point.
Okay, and then one other question regarding homeless people who are not in shelters at this point and are either living on the street or, sleeping in their cars or whatever.
Mm-hmm.
What are the plans for those folks?
So all of these programs and services that we're bringing online include focus for both sheltered and unsheltered. One of the referral agencies that we are taking referrals directly into the motels for are the outreach programs. So that includes the healthcare agencies, outreach teams, the Mercy House, and CityNet, because CityNet and Mercy House are funded to cover South and Central County SPA regions, and the healthcare agencies' outreach teams cover the entire county. They all are able to refer directly into the programs.
Okay, would that only be folks who are, at risk or are showing symptoms? Is there any, what I'm getting at is there any plan to get people who are living unsheltered right now into some kind of shelter, even if they aren't symptomatic and they haven't tested positive?
Yes, absolutely. So the focus for Joplin was actually for vulnerable populations, so individuals who are asymptomatic but either over 65 or have a chronic health condition. And the sprung structures that we're proposing through the cities would be to help both thin out the existing shelters and provide somewhere to refer individuals who are currently unsheltered.
Okay, thank you.
Sure.
Next we go to Roberto Santana at Voice of OC. Please go ahead.
And I think we have time for one more question, so this will be the last question for today. Roberto?
Yes, thanks again. Yeah, thanks again for your work. I guess maybe this question might be for Jason or Frank, as you have it. It just seems on the homeless numbers, and it just seems like the numbers that you're putting together are woefully short. If there's several thousand people that are unsheltered in Orange County, I'm hearing several hundred through the motels, maybe 100 at Joplin. It seems like you're woefully short of getting these people
sheltered, and we're 3 weeks into this crisis when they're supposed to be, kind of like separated so that they didn't get sick. So I guess my question is, doesn't it seem like you're going to bring all these things online at a very late stage in the game? And I guess that's just my question. And one quick follow-up would be, why lease all these motels and simply not purchase the most problematic motel? Wouldn't you go through a list and see what are the motels that we've had the most calls for service at from the sheriff's department and purchase those motels? Those are my two questions.
Thank you. What I would say is no. It was a week ago that the state and FEMA released their Project Room Key guidance. So I think that we jumped right on that. And in fact, I've been proud of how quickly our staff have been able to work. And, it was unfortunate that we were unable to hold on to the Ayers lease out in Laguna Woods, but we know that the operator wanted to end that agreement. So from our perspective, we are negotiating multiple motel leases. We expect to have more rooms online very quickly. We also have already placed our order for our sprung structures. And Joplin, we had a bit of an issue with the water supply because that program hadn't been operating for a year. But we expect to get that up very quickly, and that can be sized up as well. It's quite a large facility. We're aiming for 100, but it's possible that we could do more there. So I think we have developed a good regional solution, and we're going as quickly as possible. And obviously, depending upon the need, I think we're all aware that there are many motels that are struggling in terms of maintaining their revenue structure and maintaining their staff. So I think there will be more opportunities that present itself, and based on need, we will acquire as many hotels as necessary to manage this process. I don't know if Jason had any additional comments. There's one comment from Supervisor Bartlett.
So relative to the motels and hotels for purchase, that's something that I've been advocating for a number of months now, because it just makes more sense that when you are leasing them, you're turning them back over to the hotel owners and operators afterwards. We have to do a number of refurbishments, and I think it's important that we look towards not only short-term but long-term, and to get into lease options and to purchase these motels and hotels so that when we're through this crisis, we can turn these facilities into permanent supportive housing and be able to house the homeless. It just makes good economic sense to do so. And I know that the California State Association of Counties, we're working very closely with the governor's office and his staff to put together a program so that we can get additional funding to actually have lease options and purchase options for motels. Thank you.
Thank you, everyone. I want to say thank you to all the media and all the staff that were here today. That'll conclude our press conference for today. Thank you.